So you are known for sedation dentistry. What type of procedures and what type of patients are requesting this or getting sedation?
Well, interestingly enough, we'll see two basic types of patients. We'll either see the phobic patient, the patient that just can't stand the sights, sounds, and smells of a dental office.
Are there a lot of those?
Oh,
A lot of people that afraid of a dentist.
When given polls that say, what is your greatest fear? Going to the dentist generally is above heights. And that's significant. Public speaking, going to the dentist, and heights are the top three. Okay. Listening to a dentist give public speaking is number 4, incidentally, which is a little bit of information for you. Or we have patients that are just too busy. They're too busy. They know that their mouth needs a ton of work. They've got years. They've gone 15 to 20 years. They may still have kind of good teeth, but they need an oil change and a tire rotation, and they don't have time to get in there and get it done. And sedation is perfect for them because literally in 1 3 or 4 hour session, which is going to seem like 10 or 15 minutes to them, I can fix 20 years worth of neglect. We've got the technology in our office to be able to get the restorations permanently in their mouth in 1 visit.
So you're doing the IV sedation in your practice?
Myself. Yes, sir.
And I guess you were telling me less than 2% of all general dentists even offer this.
Less than 2% of general dentists are even certified to do it, and far less than that even offered in their practice. And the reason why is it's hard to run a sedation practice because of all the dynamics involved. But we focused on it very early in our practice, and we're very good at it now. Making sure that we have enough time. Part of being able to have a team that can come in and take care of the patient and do a lot of the smaller tasks is very, very important. And it took a long time to be able to build that team, but our team is very good.
Now, because of your training, I guess you do everything under one roof. So like you do your own root canals, extractions, dental implants, veneers.
I do.
So while with sedation, you could do all that.
We can do it all, literally.
You even have a machine, I guess, that makes teeth in the back.
We do.
In the same day.
In the same day.
Like a crown.
I do, yeah. And it's a bonded piece of porcelain. And so sometimes it is a crown. If I don't have to remove that much tooth structure from the tooth, I try not to. I try to be conservative because what I have in my mouth are like jigsaw puzzle pieces of porcelain that we'll just remove the part of the tooth that's affected, bond a piece of porcelain in there, and you're in great shape.
Knowing you were going to come on the show, one of my friends who gets IV sedation when he goes to the dentist, he was trying to tell me, he goes, once you get sedation, you never want to get it any other way.
That's the way it is.
Is that right?
It's awesome, yeah. I mean, myself, I'm a dentist. I do this day in and day out. If I had to go to the dentist, I don't know that I can do it nowadays without being sedated.
Now, do you offer like laughing gas, like that stuff?
Right.
Did they ever convert like those phobics? They can now graduate down to lighter sedation?
We see that very, very often. Honestly, Randy, it's trust. It's trust. It's them knowing that we're not going to hurt them, that we're going to take care of them, that everything's going to be okay. And when they start to build a little bit of that trust with us, then we'll see them sometimes convert to the laughing gas or the nitrous oxide. Okay. Because it's you can drive yourself to and from your appointment if you do that. If you get IV sedated,
you get a ride.
You can't drive home. Yeah.
Okay. So it's safe. Is it
extremely safe? There's 2 types of sedation. There's oral sedation and there's IV sedation. I've done them both. And I did hundreds of oral sedation cases. The pill.
Okay.
Grind it up, put it under their tongue. What I didn't like about them was they were not controllable. The sedation is not controllable. You literally I'd walk in the room sometimes after a half hour and the person's sitting there staring at me and I'm like, you're supposed to be asleep.
Like it hasn't kicked in.
Like it hadn't kicked in. So you give them more, you give them more, you give them more, and then all of a sudden they hit this wall and it's just bam, and they're sloppy sedated. And it can get dangerous because you don't have a main line. You have no way of making sure
to pull them out of it.
To pull them out of it, right.
Okay.
And that's what's beautiful about IV sedation. If I walk in after a couple minutes and you're still looking at me, I'll make sure you go to sleep. And if, heaven forbid, you get too sedated, I can reverse it very, very quickly because I have an IV line.
Nice. And you're monitoring what?
We monitor breathing, we monitor their heart rate, we monitor their blood pressure. If they're diabetic, we're monitoring their blood sugar. We are making sure that there's not going to be any adverse issue because of the sedation. If anything, it's better for people with some medical issues, because what you don't want is, you don't want a high stress situation.
That's a good point.
Where
Okay.
you're really uptight and you already got heart disease, you've already got a problem with with contraction, and you go in there and you're freaking out and your cortisol's kicking in and versus I take a nap.
Nice.
It's better for those types of patients.
So now there's no excuse to have the smile you've always wanted.
None whatsoever.
Don't let the fear of the dentist keep you from having the smile you've always wanted.
Don't let me get scare you. It's actually not that bad.